Hi, I'm Steve G. Jones, clinical hypnotherapist, and I want to tell you a little bit about myself before we get started. I have a bachelor's degree in psychology from the University of Florida, a master's degree in education from Armstrong Atlantic State University, and a doctorate in education from Georgia Southern University. I'm a certified clinical hypnotherapist, a member of both the American Board of Hypnotherapy and the National Guild of Hypnotists, and I'm president of the American Alliance of Hypnotists. I'm the director of the Steve G. Jones School of Clinical Hypnotherapy. I also serve on the board of directors of the American Lung Association in Los Angeles. I have over 2 decades of experience in hypnotherapy, and I still maintain a busy practice and teaching schedule because I see clients and teach classes worldwide. My client base consists mainly of people who want to lose weight, stop smoking, or gain confidence. Other clients include sales teams interested in boosting motivation and increasing income. Also, singles looking for love, insomniacs desiring proper sleep, and actors desiring more confidence for their next audition. When I travel to see clients and teach hypnotherapy certification classes around the world, I visit such places as Tokyo, Japan, Barcelona, Spain, Paris, France, London, England, Montreal, Canada, Los Angeles, California, and New York, just to name a few. By the way, since you have an interest in hypnosis, perhaps you would be interested in becoming a certified clinical hypnotherapist. It's very easy to do. All you have to do is go to my website, betterlivingwithhypnosis.com, and click on Hypnosis Classes at the top. You can either train in person or online. After your training, you'll be added to our worldwide directory of certified clinical hypnotherapists, and you'll receive a certificate. I was fortunate for many years to have my office in Beverly Hills, California, where I worked with such wonderful people as Tom Mankiewicz, the writer of Superman, Geraldine Saunders, the writer of The Love Boat, and many other celebrities. I have been interviewed on CNN, Fox News, and appeared on True TV, in addition to having my own hypnosis TV show. With my over 20 years of experience, I'm happy to share with you techniques that I've both developed and learned, which can help you improve your life. I encourage you to visit my website, betterlivingwithhypnosis.com. There you will find my life's work, 22 books on hypnotherapy, over 3,000 hypnosis recordings available as downloadable MP3s or CDs, and these recordings will program your mind to achieve goals in such areas as weight loss, motivation, and stopping smoking. I also have audiobooks, such as this one, where I'm talking with you and sharing with you in a very dynamic way techniques that you can use to improve your life and the way you do things. The reason I'm telling you all of this is not to impress you, but to impress upon you that I, your teacher, am very capable and I know what I'm talking about. I'm also very happy for the opportunity to share this information with you, so rest assured that you're in good hands, and let's have some fun as we now expand your knowledge. I wish you well in all of your endeavors, and please be sure to visit my website, betterlivingwithhypnosis.com.
So welcome to the program that's going to show you how to deal with tinnitus and how to get it under control. It's important for me to point out that I'm not a medical doctor, nor am I a licensed psychologist or licensed therapist. I'm a clinical hypnotherapist, but I have considerable knowledge about tinnitus. With that being said, always consult with your medical professional first before applying any of the techniques in this program. Do you realize that in America, over 50 million people suffer from tinnitus in one form or another? Of those 50 million, approximately 10 million have tinnitus to the level of being so severe that they actually seek medical help. Also of that 50 million, a little over 1 million have tinnitus so severely that they find it difficult to even make it through their day without being severely affected by tinnitus. In other words, they're having trouble doing what they normally do in their day-to-day activities because of tinnitus. So that's 1 million people just in America. And as you can imagine, these 1 million people are suffering so severely that it's causing sadness and leading to depression. So we've got 50 million people just in America alone suffering from tinnitus to varying degrees, 10 million seeking medical help, and a little over 1 million suffering so severely that they find it difficult to perform their daily activities. It's no wonder that over the past few years, I've received many emails asking me to please create a tinnitus recording that will help people overcome that. So that's what I've got as part of this program, a hypnosis recording designed to reprogram your subconscious mind to help you overcome tinnitus. And this part of the program that you're listening to right now is designed to educate you about tinnitus, tell you that other people are suffering and what they are doing to relieve tinnitus, because there are things that you can do which will help you get closer and closer to where you want to be, which is free of tinnitus. Now, please understand that I cannot claim to cure anything. However, the techniques that I'm going to share with you are time-tested, and many have found relief from tinnitus by using them. Let's first look at what is tinnitus. Well, if you're listening to this program, you're probably no stranger to tinnitus. But just to be clear, tinnitus is the awareness of a sound in either one or both ears and or the head itself with no external reason for that sound. So if you're hearing sound in your ears and the TV's on near you, that's a reason for the sound. But if you're hearing a ringing in your ears or some other type of sound in your ears and there's nothing externally going on to generate that sound, that's defined as tinnitus. Now that's the definition from the ATA, the American Tinnitus Association. That's the official definition. It's often called ringing in the ears. But this can be misleading because it can be a clicking, a hissing, a buzzing, a chirping, a whistling, a thumping, and some people even hear music. And the sound can be a constant sound, which is heard all the time, or something that comes and goes, or something that has multiple tones. Now, I want you to imagine, and if you have tinnitus, this doesn't take much of an imagination, but if you're listening to this to help someone else, imagine going to a medical doctor with tinnitus and trying to describe what you're hearing. Because when you have tinnitus, sometimes initially at least, you think that everyone else is hearing that. You think it's just a sound that's in the environment. And then perhaps you think you're losing your mind because you're hearing things, and then going to a medical professional and trying to explain what you're hearing. This can be very aggravating. This can be very frustrating. It's not as if you can say, look at this or listen to this, and the doctor can look at it or get in your head and listen to it. It's something that only the individual is experiencing, so it can be very difficult to explain to a medical doctor. And then imagine going to the medical doctor, explaining it, having it diagnosed as tinnitus, and then being told that there's nothing that can be done. Maybe you're in that situation. I know I had a situation recently at my house where one of my neighbors had a sailboat. I live on the water, and one of my neighbors a few doors down had a sailboat, and on the main pole that goes up the sailboat, there were cords coming off of it, which, when the wind blew, would bang against the pole. Ting, ting, ting is what I heard all day and all night. And I went over to them and I tried to describe what I was hearing. They heard it too, but it didn't bother them because they were so used to hearing it. My frustration in dealing with them is nothing compared to a tinnitus sufferer's feelings of frustration in talking to a medical professional who doesn't quite understand what's going on. At least my neighbor could hear the ting, 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 even though it didn't bother them. By the way, I finally got them to take care of it by attaching the ropes more tightly to the pole. But with tinnitus, it's not that simple. It's not that simple to describe. It's not that simple to get someone to understand. And there's no way to let the other person hear it, no matter how badly they want to hear it. So when we have a sound that bothers us and it has a physical reason, a physical origin, as with the sailboat, that's easy to deal with. There's a simple solution. When it's just in our heads and generated from within, that can be a little more complicated. Let's take a look at what causes tinnitus. There are several things that can cause tinnitus. For example, medicine can cause tinnitus. Some medications are ototoxic, O-T-O-T-O-X-I-C. This means that they can cause tinnitus. But sometimes with medicine, it's worth taking even if you're going to have a ringing in the ears temporarily. Again, remember, I'm not a physician, so you should always consult with your physician before taking any medication or when considering changing or getting off of medications. And if you suspect that your medication is causing tinnitus, talk to your doctor. Maybe it is, and maybe a change can be made. Something else that can cause tinnitus is hearing loss. Now, just because you may be losing your hearing doesn't mean you'll develop tinnitus. But it's interesting that sometimes the noises that are in a tinnitus sufferer's head seem louder when outside noises can't be heard. So in other words, if the tinnitus sufferer can no longer hear the TV and the radio and the neighbor's dog and anything else that's going on in the environment, anything else that's actually there externally, then the volume gets turned up internally. So something could have been there all along, but it's just made more obvious when hearing loss sets in. Also, loud noises. Let's face it, rock concerts are not the place to go if you want to preserve your hearing. Now, when I say loud noises, I'm talking anything over 80 decibels. 80 decibels is really loud, and being exposed to that for a prolonged period of time, let's say 1 to 3 hours, typical length of a rock concert, can cause tinnitus. Tinnitus can also be caused by a loud noise of limited duration. For example, firing a gun without wearing protection over your ears can cause hearing loss. And the reason for that is that there's damage done to the hearing nerve and or the inner ear. This can result in tinnitus. So, at the rock concert or any other concert, wear hearing protection. Put something in your ears. This is whether you have tinnitus or not. Wearing proper ear protection, which by the way is sold at a lot of grocery stores, at least in the United States, wearing that ear protection can go a long way. You know those little rubber ear protectors that you put them in your ear and then they expand? Those can save your hearing and prevent tinnitus if you don't already have it. It can also keep your hearing from getting worse. And of course, anytime you fire a weapon, wear hearing protection. Usually shooting ranges will provide what look like earmuffs or old stereo headphones that completely cover your ears. So if you're exposed to loud bursts of sound or ongoing high decibel sounds, wear ear protection. Now I want to give you a list of drugs, and these drugs are known to cause tinnitus. What do I want you to do with this list? Well, if you're on any of these drugs, don't just stop taking them. I want you to consult with your physician and see if perhaps there's an alternative. Remember, only your physician can decide for certain. But I want you to be aware that some drugs you may be taking could be contributing to or in fact causing your tinnitus if you have tinnitus. This list includes loop diuretics, that's L-O-O-P, and the next word is D-I-U-R-E-T-I-C-S. Next would be quinine products, Q-U-I-N-I-N-E products, and aspirin. Next would be anti-neoplastics, that's ANTI-NEOPLASTICS. These are anti-cancer drugs. Next, aminoglycoside antibiotics. 2 words. First one is spelled AMINOGLYCOSIDE. The next word is antibiotics. ANTIBIOTICS. Aminoglycoside antibiotics. And the last category, which can be the most difficult to pin down, would be a long list of chemicals. The list includes mercury. Next one is butyl nitrite, B-U-T-Y-L. Next word, N-I-T-R-I-T-E. Styrene, S-T-Y-R-E-N-E. Carbon disulfide. Disulfide is spelled D-I-S-U-L-F-I-D-E. So 2 different words, carbon disulfide. Carbon monoxide, tin, lead, hexane, H-E-X-A-N-E, manganese, M-A-N-G-A-N-E-S-E, xylene, X-Y-L-E-N-E. If you have been exposed to any of these chemicals, ask your physician if they might be contributing to tinnitus. And if you are still being exposed to any of them, for example, in your workplace, talk to the people in charge and find out if you can get away from these chemicals. Because these chemicals, which you can be exposed to in your workplace, can be causing or contributing to your tinnitus. Let's look at other things that aren't chemicals that can cause or contribute to or worsen tinnitus. Wax in the ears. And it's interesting how wax in the ears works. Much like hearing loss, when you have a wax buildup in your ears, it blocks sounds. So the sounds that you were once able to hear clearly from your environment, sounds that are actually outside of your head, caused by TVs, radios, air conditioning, whatever it may be, those sounds are no longer able to be heard by you as efficiently as they were in the past. So wax buildup can contribute to tinnitus by contributing to hearing loss. So once your perception of outside sounds is reduced, your perception of internal sounds, which were there all along, is increased. It's a very important distinction. So the wax isn't actually causing the tinnitus per se, but it's allowing you to become more aware of it. I want to tell you now about some treatments for tinnitus that you may not be aware of. Now again, I want you to talk to your medical doctor before using any of these, but I want to enlighten you about a whole host of treatments available that you may never even have heard of. You know, as a hypnotherapist, I'm always interested in techniques that will help people which are not drug-based, which don't carry with them a side effect, because sometimes we try to solve something with medicine and we get the side effects of the medicine. Maybe we solve the first challenge, but now we have a new challenge. So let's take a look at a lot of different ways to approach tinnitus, including medicine, but some ways that you may not have even thought of. Let's look at acupuncture. You know, when I had my office in Beverly Hills, I was fortunate to have an acupuncturist in town, and I could refer patients to him, and he would refer patients to me. I was the hypnotherapist, he was the acupuncturist. Most places, it doesn't have to be Beverly Hills, California, most places have an acupuncturist, or sometimes several acupuncturists. Ask around, find out what people are saying about the acupuncturist you're thinking of going to. Acupuncture has been used for a long time in Asia for treating tinnitus. So I invite you to explore that as a potential healing modality. Also, maskers. You may not have ever heard of a masker, but a masker is an electronic device that uses sound to mask the tinnitus. So rather than making tinnitus disappear, maskers make the sound of the tinnitus seem less. And as an example of this, when I had my office in Beverly Hills and I was treating celebrity clients, I didn't want the people in the waiting room to be able to hear what was going on in the treatment room. The waiting room was right next to the treatment room. I was the only practitioner in the office. When people came, they wanted to see me, so I had a smaller office, but the drawback was the waiting room was directly adjacent to the treatment room, only divided by a wall. And patients would tell me that they could hear while in the waiting room what was going on in the treatment room. Well, hypnotherapy is a very private experience. A lot of things talked about before the hypnotherapy session are very private. They're intimate details about the person's life that they're telling me. So here I had these actors coming into my office telling me the details about what's going on in their lives, and people in the waiting room able to hear them. Well, I didn't want this to persist, so I bought something which another practitioner in the same building told me about, which was something that would mask the sound. It created a white noise, as it's called. It sounded sort of like a hissing. Or, I guess if you used your imagination a little bit, it could sound like the ocean. But it was designed to mask the sound. The sound of me talking to my clients didn't go away. It was just masked by this little machine that I could plug into the wall that would make noise. Well, that's the way maskers work. So you, if you're having challenges with tinnitus, can get a masker. Let's say you're trying to sleep at night and tinnitus is kicking in, and all you're thinking about is the sound in your head. Well, a masker, an external device that's not even connected to your body at all, just an external device that you can put anywhere in your bedroom or any room that you want to be in, will mask the sound. You will actually be hearing the sound in your head and the external sound, but the external sound takes over, so that you reduce your perception of the sound in your head or eliminate your perception of it. Keep in mind, you're not reducing the actual sound in your head any more than I was reducing the sound of myself talking to my clients in my Beverly Hills office. You are, however, offering another sound. So people in my waiting room heard the other sound and no longer heard the sound of me talking privately with my clients.
All right, let's take a little break now. We're about halfway through the material that I've presented, and I want to make sure that you're with me, that you're paying attention and that you're learning something. So what I want you to do right now is, if you're driving and you can pull over, go ahead and do that. If you're not driving, then you can definitely do this. You can take out a piece of paper and you can write down 5 things that you've learned so far from what I've said. 5 things that resonated with you. Now, I want you to keep in mind, they don't even have to be 5 things that I said. Maybe you got some good ideas from what I said. Maybe I said something and your brain took it and blew it up a million times and came up with all kinds of wonderful, amazing possibilities based on what I said. If that's the case, then feel free to write that down. I just want you to write down 5 things, whether they came from me or they're just thoughts that came in your head. 5 things that have come to you so far, either from me saying them or from you thinking them, as a result of listening to this program so far. So as I'm silent, I'm going to give you ample time now. I want you to write down 5 things, 5 thoughts that you have as a result of listening to this program so far. Do this now. Okay, do you have your 5 things? If not, go ahead and finish them up. 5 things, write them down. So I'm going to move forward now. Let's take those 5 things that you have written down, and I want you to elaborate on them. For example, if you have an insight number 1, that I should change blank about myself, whatever it may be, I want you to elaborate on that. Whatever you've written down for point number 1, something that's come to you during listening to this program, I want you to elaborate on that now as I'm silent. Good. And now I want you to take point number 2 and elaborate on that. What was the second point that you wrote down, and how can you enhance this idea? I want you to make it real for yourself, because I want you to have, after you finish this program, something you can use. So on point number 2, elaborate on it. Consider what you wrote down as point number 2, the foundation. Now build a house on it. Go ahead and write down something now as I'm silent. Good. Now you're getting some momentum. Now for point 3. Point number 3 that you wrote down, something that came to you as you listened to this program. I want you to elaborate on point number 3 as I'm silent. Good. Now take point number 4, the 4th point that you wrote down, something that came to you while you're listening to this program. I want you to elaborate on point number 4 as I'm silent. Great. Last but not least, point number 5. Take point number 5 and elaborate on it as I'm silent. Good. So now you have something that you can take with you after this program. You have those 5 points that you elaborated on, and you can use them after this program's over. So let's continue on with the information now.